All right, we're going to go ahead and get started now. So welcome everyone. Thank you for coming tonight. Welcome to What's the Prescription for Healthcare Reform? My name is Stephanie Stramotis, and I am the president of the American Medical Student Association, UC Berkeley Pre-Medical Chapter, and I'm also a graduate student in the School of Public Health. Tonight, our purpose is to stimulate discussion as well as political involvement among Berkeley students for delivery reform as well as health insurance reform. This event would not be possible without the numerous organizations that supported it. So I'd like to thank the American Medical Student Association, the relatively new Berkeley Students for Healthcare Reform, the Boalt Hall Democrats, the Cal Berkeley Democrats, the Berkeley College Republicans, the Center for Health Leadership, the Graduate Assembly, the Social Welfare Graduate Assembly, and the ASUC. So the format of tonight is going to, and also CalPERG. I'm sorry, and we'd like to also add CalPERG. Thank you for your support. Is there anyone else I missed? Great. So the format of tonight, we're going to first start with our three panelists, and they're each going to present for about 15 minutes. After that, we're going to have a question and answer session among the panelists for 15 minutes, and then we'll transition into a question and answer session open to the audience. So we'd like to ask that you write down questions on the note cards that you received and pass them down the aisle before the question and answer session for the audience begins. I'd like to thank you again for coming tonight, and now I'd like to direct you to April Elliot. Thank you.
Good evening. Thanks everyone for being here. I'm April Elliot. I'm a second-year law student here at Boalt. I'm also vice president of the Boalt Hall Democrats. And I'm just going to go ahead and introduce our speakers and then hand it over to them. So first we have Professor Helen Halpin. She's a professor of health policy. She's the director of the Center for Health and Public Policy Studies here at Berkeley. She's a vice chair of the California Health Benefits Program. She served as a health policy advisor to Barack Obama's presidential campaign. She's also on the editorial board of the Public Health Review at the French School of Public Health. And her research focuses on, and advocacy work focuses on universal access to comprehensive health care, insurance, and insurance reform to include preventive care and promotion of public health. Next, we'll hear from Professor William Dow. He's the Henry J. Kaiser Associate Professor of Health Economics here at Berkeley. He's the chair of the Health Services and Policy Analysis Graduate Group, the Associate Director of the Berkeley Population Center. He's worked with both Democratic and Republican groups on health sector reform proposals at the federal, state, and local levels. He's a research associate with the National Bureau of Economic Research, and he previously served as a senior economist at the White House Council of Economic Advisors. And our final speaker for this evening is Professor Stephen Shortell. He's the Blue Cross California Distinguished Professor of Health Policy and Management. He's the Dean of the School of Public Health here at Berkeley. He's an advisor to the Obama administration on healthcare delivery system reform. He's conducting research on accountable care organizations, patient-centered medical homes in regard to their ability to improve quality and control the costs of healthcare. So I'd like to bring Professor Halpin up to start.